Hello, everybody. Andrea Twarowski here with Dentalelle Tutoring, and this is another patient edition file. Now, this may seem kind of silly, but I kind of would like to tell people and talk to people about this. So you might be a patient, and that's why you're watching this. You may be an actual person who sees the dental office, right? And you might be wondering, why are they always late? You may be annoyed. You may be thinking, why is my dental assistant, dentist, dental hygienist always late? They get mad when I'm late, but when they're late, I just sit there and sit there and sit there. Like, don't they realize that my time is valuable? So if you're watching this, you might be wondering that. And if you're a dental hygienist or a dental assistant watching this, or a student, you might be wondering, well, what's the best way to explain to patients why we're late? So let me first say, we don't do it on purpose. Trust me, we have hard days too, okay? We are always like, hurry, hurry, hurry. We are trying to be as quick as we can. And what you may not know as a patient is we see people back to back. We do not see a patient and then get a 15-minute break, and then see a patient and then get another 15-minute break. We see a patient back to back. So when I'm a hygienist cleaning somebody's teeth, and let's say I start at 9 in the morning, at 9:45, your appointment's done, and I see another patient at 9:45. That is when their appointment is. So if you think about it, like, I have to spend the full amount of time on you, of course, and then as soon as you're done, well, I have to see my next patient. But it's not as simple as that. After we see somebody, we need to take notes in the chart, because we don't have time to take notes while we're cleaning your teeth, because we're cleaning your teeth, right? And then guess what? We have to sterilize the room. We have to disinfect the room. We have to sterilize everything that we had used inside your mouth, because we sterilize every single thing for every new patient. So inside the room, we need to disinfect. So the counters, anything we touched, the actual chair, the sunglasses, we disinfect all of that. But we sterilize all of the instruments, and then pretty much anything that you had inside the mouth. And that just doesn't happen magically, right? So we have to take away all of the instruments, we put them all back on our tray, and then we have to take them into a room to sterilize them. And again, that just doesn't happen magically. We can't just throw that all into a sterilizer and then done. We have to separate them, okay? So that's another infection control lesson, so I won't talk about that here, but it takes a good 5 minutes because we do it properly. We take these things seriously. But remember, we have to go back and disinfect the entire room. And for things to be disinfected, we have to let it sit for up to 3 minutes. So again, doesn't happen magically. So then we can write up our notes, and we usually have to let the receptionist know what we did for that appointment so that they can enter in the codes. They are booking your next appointment, or we are, depending on the office. And then they have to make sure you're signed out. You sign everything you have to sign for insurance purposes and that type of thing, right? But don't forget, as I said, we have to take our notes, and then we have to set up for the next patient, right? That takes time because everything's clean. We have to make sure. But taking it a step further, our next patient, we have to look in the notes to see what we're doing, because not everyone's coming for the same appointment. You might be coming for a cleaning. You might be coming for a cleaning and checkup. You may need x-rays. You may not need x-rays. You might be coming because you have a sore tooth. So every single appointment needs something different. So we need different instruments. We have to prepare a certain way, things like that. And I'm just going to be honest here. Think about this too. What if you arrive 10 minutes late? I am now 10 minutes late, so more behind, which is fine, but I can't say to you, okay, we'll all clean your teeth halfway, because that's all I have time for, or I'll clean every other tooth because that's all I have time for. We can't do that, right? we clean all of the teeth no matter how much time we have, and we do a good job. We can't say, well, I'll just do this quickly. No, we have to do a good job because you came here, so now you're expecting us, of course, to do a good job. So we can't just do every other teeth or, you know, be lazy, okay? We have to clean every single tooth. And if you have a lot of plaque and a lot of tartar because you're not using the floss every day, it takes us longer. So that's why we're so happy when you don't have a lot of plaque or tartar, because then we can, you know, take it easy a little bit. You know, we don't have to work so hard. We don't have to hurt you. We can sort of be like, okay, that appointment wasn't so bad because this person likes to use the floss every day and they brush twice a day. This is awesome. Like, we love that. But having that said, we love everybody. So come in any way to have your teeth cleaned because we love you. But that's how it happens, you guys. So, and it's not always our fault. If a patient's late, well, that sets us behind. And think about us poor souls too, okay? Since we don't get breaks, the only break we get is lunch. Some offices, it's a half an hour. Some offices, it's an hour. But if we're constantly, let's say 15 minutes behind, we might not get a lunch, okay? That's not fair and that sucks, right? But we have to be on time for the next patient. So you might be seeing us. We might be so hungry or thirsty. We haven't had time to have lunch yet because people have been behind all day, or we have been behind. So think twice before you're mean to us. Think twice before you say, I have been waiting for 5 minutes. Like, what took you so long? Think twice, okay? Those 5 minutes might have meant that we were able to have a quick lunch, or we were able to use the washroom, okay? Think about us for like a little bit, okay? We are always like, we are sorry that we kept you waiting. We are always sorry, trust me. We don't do it on purpose. And also remember, you know, if we're behind, it means that we will probably be leaving much later that day anyway. Like, our job isn't a typical 9 to 5. It's pretty much 8:30 to like 6, depending on how late we are. So think about us. This is healthcare. We just never know. And if you have more plaque or tartar than you had the last time, we might not have booked you long enough. So we have to spend more time on you, which means we will be behind. We will be behind, but we love all of you. So we don't mind doing that. We just get a little, I guess, offended when people yell at us for being late, or they're mad at us for being late or behind. We can't help it, and we don't like it, trust me. So please be patient with us, and thank you for understanding. I do hope this helped, and I'll see you guys in the next video.